So what are the different treatments available for sarcoidosis? So sarcoidosis, because this is an illness that is not completely understood in terms of the cause, the treatments really are geared towards alleviating inflammation. There's not necessarily going to be one cure or one particular treatment. Now, when we talk about treatment, there's several key medications to mention. So number one are going to be glucocorticoids. So these are steroids such as prednisone. And this is really the hallmark of treatment for sarcoidosis and really first line treatment. And typically patients are on between 6 to 12 months of therapy with prednisone. And sometimes this is really all that they need in order to decrease the inflammation, to decrease the size of the granulomas. And we have to remember, very important with the glucocorticoids of prednisone, the long-term side effects. And so this includes weakening of the bones. This includes developing diabetes, high blood pressure, cataracts. All these things are real. We really do see them. And so that's why we really try and limit as much as possible the dosages of the steroids and taper them as soon as we can. So that's number one. Number two is a medication called Methotrexate. So this is an immune suppressing medication. It's a medication that decreases inflammation in the body. This is a medication that's weekly, and we do need to monitor lab testing frequently while on this medication. So that's a second one. There's various other immune suppressant medications that can be sometimes given in order to help reduce the dose of the prednisone that's given. The one that's really worthwhile to mention are these medications called TNF inhibitors, also known as biologic agents, and these are really becoming very popular in treatment for sarcoidosis. And they're typically, a lot of the research was done on treatment for rheumatoid arthritis, but we've been noticing that patients with sarcoidosis that have really aggressive disease, or if they have disease that's failed traditional treatments, they've had really good responses with these biologic agents.